Hey there, Coach Farhad here. Today I want to talk to you about something called anterior pelvic tilt, and it's something that I see a lot of people suffer with when they come into the studio to work with us. Now, what anterior pelvic tilt is, and you might have it yourself, is when your pelvis, okay, so your pelvis is it's sort of like in this area here, tilts forward like that, and because your pelvis is tilted forward, hence the name anterior pelvic tilt, your lower back has to compensate by tightening up to straighten your body, and you have this sort of like curve going on in your lower back, and you're walking around like this, okay? This is very common. If you suffer from lower back pain, potentially you've got anterior pelvic tilt. And how would you know you've got anterior pelvic tilt? Look in the mirror and see when you're standing straight, if your back's straight, or if you've got this sort of curve going, your bum's going back a bit, and you've got this dip in your lumbar region of your spine, okay? How do we fix this? Well, first of all, what causes it? Now, there's two main causes of anterior pelvic tilt. There are a few other causes, but the two main ones that most people suffer with, and it's due to the lifestyle most people live, it's the tightening or shortening of the hip flexors that do this movement. So you've got your rectus femoris and your iliopsoas muscles in this area that cause that tightness, and a weakening or lengthening of your glute muscles, okay? Now, why does that happen? Well, if you think about it, most of us are in this position throughout the day, okay? So we're sleeping like this all night with our hips flexed. We get up, sit down for breakfast, get up, go in the car or in the bus or the train, we're sat down, walk to the office, walk to our desk, sit at our desk for about 8 hours, walk to the car, drive home, get home, plant yourself on the couch, eat your food on the couch, go to bed. Okay, you're very rarely in this straightened position which we were designed to be in. So those muscles get tight and weak. Now, when somebody comes to me and I see they've got anterior pelvic tilt, there's a couple of things I'll do. And one thing I would genuinely not program or recommend for clients that come in with anterior pelvic tilt, I wouldn't get them to do any sort of back squats, deadlifts, or any exercises that require, good stability throughout the hips. I'd get them to fix the problems first and do sort of like remedial work and work that's a bit lower level to help them get the glutes stronger and to work the hip flexors. So, how do I know what's going on inside a human body when a client comes in? There are tests that I perform with my clients, but obviously I can't perform these tests with you via camera. So I'm just going to show you two quick exercises that you can do at home or at the gym that can help you get rid of this anterior pelvic tilt, and you can incorporate and hopefully alleviate the problems within a couple of weeks. That's usually the time frame that I see. So the first thing we're going to do is we are going to work on lengthening, stretching out the hip flexors. And the first thing we're going to do is just a quick quad stretch. You can do this whilst you're watching TV. I recommend that to my clients. So you get your sofa or a chair, you put your leg on your sofa or your chair like this, like in a Bulgarian split squat position. You have a cushion on the floor, okay? And then you just sort of, although I can't reach it, but you just sort of like stretch out and stand like this in this position. You can watch TV or read a book or whatever. About 30 seconds to a minute on either side, okay, for 3 to 4 sets, and really feel the stretch, really push your hips forward, okay, and you'll feel that stretch out, okay. Now when it comes to your glutes being weak, a great exercise for this is a glute bridge or a hip thrust, and I've just made a video on this before. So you're on a bench or you've got something where your shoulders can rest on, okay, your glutes are nice and contracted, chin down, okay, you can rest a weight. If you're in the gym, you can put a barbell or a dumbbell on your lap. If you're not at the gym, you can, just put some weight on your lap and coming down slowly. Now what you want to do, you keep your abs tensed, keep your chin down, go down until you can't feel yourself be able to go down anymore in this position. If I didn't have my abs tight, my chin down, I could do this, okay? But I don't want to do that because I want to keep my active range of motion. So chin down, abs tight, and I'll stop around here somewhere, keep my glutes nice and squeezed. From here, drive my hips up. Slowly down, everything tight, and drive my hips up. Okay, so that's the glute bridge, and that will sort of like activate the glutes. Now if you're doing any glute work, Might be good to do that as part of your warm-up, just to get your glutes activated. The last thing I want to share with you is just posturally, what you can do when you're walking around is try to keep the glutes tight. So if you see straight away, when I do the glutes tight thing, my hips come forward anyway. Okay, so I sort of lose that. And I want to keep my abs tight and sort of like just walk around. So walk around like this. And it looks a little bit of John Wayne-y, okay? But you're training your muscles to stay active. So, you know, if you're at home, just walk around with that a few times. Or if you're shopping in the shops, you've got your shopping trolley, no one's looking. Just make sure your butt cheeks are tight, hips are forward, abs are tight, and you're walking around like that for a little bit, just to train the muscles that will help you alleviate anterior pelvic tilt. Once you've alleviated your anterior pelvic tilt, you can go into more sort of complicated exercises like deadlifts and squats, etc. But please stay away from those until you're ready for them and you are able to perform those movements safely and effectively. Okay, so I hope this video has helped you. If you have any questions, give me a shout. I'm more than happy to answer your questions. And I'll see you in the next video. Have a great day. Take care. Stay safe, stay healthy, stay fit.